Did you know that over 350 million men worldwide suffer from some degree of erectile dysfunction? And here's the shocking part. By the age of 40, almost 40% of men are already experiencing it, and most never talk about it. But what if I told you there's a small pill, originally created for the heart, that not only helps in the bedroom, but could actually change how your body feels and functions every single day? That pill is Tadalafil. Popularly known as a treatment for erectile dysfunction, it's often seen as a performance enhancer. But the truth is much bigger, because when you take Tadalafil consistently for 30 days, the effects go far beyond intimacy. They can touch your energy levels, circulation, mood, and even your long-term health. But here's the twist. Most people don't know about a hidden benefit of Tadalafil that has nothing to do with sex. And this discovery could transform the way medicine sees this drug in the future. I'll reveal this secret in the final chapters, so stay with me until the end. In today's video, we'll break down exactly what happens inside your body during 30 days of Tadalafil use, from the first week to long-term adaptations. We'll cover the good, the bad, and the surprising, so that by the end, you'll know whether this is something worth discussing with your doctor or a risk you should never take. But before we dive in, let me ask you, have you ever wondered if a pill designed for one purpose could actually make you healthier in completely different ways? Today, you're going to find out. Tadalafil is not just another pill for performance. And in fact, when scientists first developed it, the focus wasn't even on sexual health. It was designed as a cardiovascular drug to improve blood flow and reduce strain on the heart. Only later did doctors realize that the same mechanism could help men with erectile dysfunction. But how does it actually work inside your body? Let's break it down simply. Your blood vessels are like flexible pipes. Normally, they expand and contract depending on the signals your body gives them. One of the key signals comes from a molecule called nitric oxide. This molecule tells the muscles around your blood vessels to relax, which allows more blood to flow in. Here's where Tadalafil comes in. Inside your body, there's an enzyme called PDE5, and this enzyme acts almost like a brake, stopping nitric oxide from doing its job. What Tadalafil does is block PDE5, taking the foot off the brake. The result? Your blood vessels stay more relaxed and circulation improves. That's why erections become easier, because the penis depends entirely on good blood flow. But think about it. If Tadalafil improves circulation in one part of the body, wouldn't it also help blood flow in other places, like your heart, your lungs, even your brain? And here's the surprising part. Unlike other drugs in its class, Tadalafil is nicknamed the weekend pill. Why? Because while most pills last for just a few hours, Tadalafil can stay active in your body for up to 36 hours. That's a day and a half of continuous support to your circulatory system. But that doesn't mean everything is positive, because as blood flow changes, so do other processes in your body, and not everyone reacts the same way. In fact, during the first week of use, many people notice changes that might surprise you, and that's exactly what we'll explore in the next chapter. Day 1 to 7. Immediate effects you might notice. So what really happens in that very first week of taking Tadalafil daily? The answer might surprise you, because the effects aren't limited to the bedroom. For many people, the first noticeable change is improved circulation. Within hours of your first dose, blood vessels begin to relax, and blood flows more freely. This is why some men report feeling a slight warmth or even a flushed face in the first days. It's the body adapting to a new level of vascular activity. But that's not all. Some users describe a boost in energy and confidence almost immediately, not necessarily because the pill is a stimulant, it isn't, but because improved blood flow can help oxygen and nutrients reach muscles and tissues more effectively. Imagine fueling your body like a car engine suddenly receiving premium gasoline. However, there are also side effects that can show up early on. The most common are mild headaches, nasal congestion, and back pain. Why? Because those same blood vessel changes that improve circulation in the penis also affect other areas of the body, including the head and spine. And here's something important. During this first week, some people may not notice much change at all. That doesn't mean it's not working. Tadalafil often builds up its full effects over time, especially when taken in low daily doses. Think of it as training your blood vessels to stay more open consistently. But here's the real question. If the first week is mostly about your body adapting, what happens once the adaptation begins? Because around week 2, something shifts. And it's not just physical. In the next chapter, we'll uncover how subtle changes in libido, mood, and even daily confidence start to show up after the second week of Tadalafil. By the second week, something interesting begins to happen. The body is no longer just reacting to Tadalafil, it's starting to adapt. And that's when changes in daily life become noticeable. One of the first things many people report is a shift in libido and sexual confidence. It's not only about erections being easier, it's about the mindset that comes with it. When performance anxiety decreases, stress levels tend to drop as well. Imagine the ripple effect: less anxiety, better sleep, more relaxed interactions during the day. But it doesn't stop there. Because Tadalafil enhances blood flow throughout the entire body, many users feel more physically capable. Some describe workouts feeling lighter, as if muscles recover faster. Others notice that simple activities, climbing stairs, walking longer distances, feel easier. Science suggests this may be linked to better oxygen delivery to tissues. Another subtle but powerful effect is on mood. Improved circulation can indirectly support brain function, which explains why some users report feeling more alert, focused, and even optimistic. It's not a direct antidepressant effect, but think about it. When your body is working better, your mind often follows. Of course, there's also the placebo factor. Just knowing you're taking something that improves performance can boost self-esteem. But here's the key. Many of these changes are backed by real, measurable improvements in blood flow and vascular health. Still, week 2 can bring challenges too. Some people may notice mild muscle aches or indigestion. These side effects are usually temporary, but they're reminders that Tadalafil isn't just acting on one part of the body, it's influencing your entire vascular system. But here's where things get even more fascinating. By week 3, Tadalafil begins to reveal benefits most people never expect. Benefits that go way beyond the bedroom. In the next chapter, we'll uncover unexpected effects of Tadalafil on heart health, circulation, and even exercise performance. By the third week of daily Tadalafil use, the story takes a surprising turn, because while most people expect improvements in sexual performance, they don't realize the drug may also bring benefits for the entire cardiovascular system. Here's why. When Tadalafil improves circulation, it's not selective. It doesn't just target the pelvic region, it works on blood vessels throughout the body. And that's where some fascinating effects start to show. 1. Heart and blood pressure. Some studies suggest that Tadalafil may help lower blood pressure slightly, especially in people with mild hypertension. The constant relaxation of blood vessels means the heart doesn't have to pump as hard. For some, this can translate into reduced cardiovascular strain and better endurance during daily activities. 2. Exercise and performance athletes and active individuals often report that their stamina improves. This is not because Tadalafil is an energy booster, but because muscles receive more oxygen and nutrients. Even walking, running, or weight training may feel smoother. In fact, researchers have explored Tadalafil as a potential aid for people with pulmonary hypertension to improve exercise tolerance. 3. Brain and focus. Improved blood flow doesn't stop at the body. It reaches the brain too. Some users report clearer thinking and sharper focus. While research in this area is still emerging, there is growing interest in how PDE5 inhibitors like Tadalafil might support cognitive function by increasing cerebral circulation. But let's not forget, not every unexpected effect is positive. Around week 3, some people may notice side effects like muscle soreness or indigestion becoming more persistent. This is a reminder that the drug is systemic. It works everywhere, and that comes with trade-offs. Still, the balance of evidence suggests that for many people, by week 3, Tadalafil is doing more than anyone expected, and the real transformation happens after a full month of use. In the next chapter, we'll see what happens on day 30, long-term body adaptations, and whether daily Tadalafil is truly a game-changer or just another pill with limits. After a full month of daily Tadalafil use, the body reaches a point of steady adaptation. This is when the effects go beyond short-term improvements and start shaping longer-term changes in how your cardiovascular system and overall well-being function. 1. Consistent blood flow. By day 30, blood vessels are now consistently more relaxed, which means oxygen and nutrient delivery to tissues is more stable. Many users report that their energy throughout the day feels more even, less fatigue, more stamina, and in some cases, improved recovery after physical exertion. 2. Improved sexual health. It's not just about erections anymore. With consistent use, many men notice better spontaneity. Instead of planning around a pill, daily dosing keeps the system primed, which can reduce anxiety and restore a sense of normalcy to intimacy. 3. Cardiovascular benefits. Emerging research suggests that long-term use of PDE5 inhibitors like Tadalafil may support heart health by improving endothelial function, the inner lining of blood vessels. A healthier endothelium means better circulation, less arterial stiffness, and potentially lower risk of future cardiovascular problems. 4. Mood and confidence. Here's something many overlook. After 30 days, it's not just the body that changes, but the mind. Confidence improves, stress decreases, and in some cases, people feel more motivated to take better care of themselves. It's a positive feedback loop. The drug helps performance. Performance reduces stress. Less stress improves overall health. But let's also face the reality. After 1 month, side effects can also become clearer. For some, headaches, indigestion, or muscle pain may persist. Others may even develop tolerance, meaning the effects feel less noticeable over time. And there's always the question, is it safe to continue long-term without medical supervision? That brings us to an essential point. The risks, side effects, and common mistakes people make when using Tadalafil without proper guidance. And trust me, some of these mistakes can be dangerous. In the next chapter, we'll break down the hidden dangers, side effects, and errors to avoid when taking Tadalafil regularly. By now, it's clear that Tadalafil can offer impressive benefits, but no drug is without risks. After 30 days of continuous use, it's time to talk about the downsides and dangers that often go ignored. 1. Common side effects. The most frequent complaints include headaches caused by blood vessel dilation in the brain, nasal congestion due to increased blood flow in nasal tissues, indigestion and acid reflux because Tadalafil relaxes not only blood vessels but also the muscles that keep stomach acid in place, back and muscle pain, possibly linked to changes in blood flow in the spine and muscles. For most people, these effects are mild and temporary, but for others, they can be persistent and disruptive. 2. Serious risks. The real dangers come when people use Tadalafil without medical supervision. Drug interactions, combining it with nitrates or certain blood pressure medications, can cause a dangerous drop in blood pressure, leading to fainting or even heart attack. Heart strain. For individuals with undiagnosed heart disease, sudden changes in blood flow can trigger cardiovascular events. Vision and hearing problems. Rare, but cases of sudden vision or hearing loss have been reported, likely due to disrupted blood supply in the eye or ear. 3. Common mistakes. Self-medicating without diagnosis. Erectile dysfunction can be an early sign of serious conditions like diabetes, high blood pressure, or heart disease. Taking Tadalafil without addressing the root cause is like covering a warning light on your car dashboard, overdosing or doubling up. Some men, frustrated by results, take more than prescribed, which only increases risks without real benefits. Ignoring lifestyle factors, thinking the pill alone will solve everything while neglecting diet, exercise, and sleep. Tadalafil is a powerful tool, but it's not magic. Without proper guidance, it can become a dangerous shortcut. But here's the fascinating part. Even with all these risks, researchers are uncovering a hidden benefit of Tadalafil that has nothing to do with sexual performance. And this could change the way doctors see the drug in the future. In the next chapter, we'll finally reveal the surprising hidden benefit you probably didn't know about. Until now, we've focused on the well-known effects of Tadalafil: improved circulation, better sexual performance, and even some cardiovascular support. But here's the twist. Scientists have been uncovering a hidden benefit that most people have never heard of. Tadalafil may actually play a role in supporting lung health. 1. Pulmonary hypertension. Originally, one of the medical uses of Tadalafil was for a serious condition called pulmonary arterial hypertension, high blood pressure in the arteries of the lungs. By relaxing those blood vessels, Tadalafil makes it easier for the heart to pump blood into the lungs, improving oxygen delivery. For patients with this condition, it can mean better breathing and improved exercise tolerance. 2. Respiratory function. Even in people without pulmonary disease, some studies suggest that Tadalafil might enhance lung function by improving airflow and circulation in pulmonary tissues. This is why some athletes have speculated about its potential performance-enhancing effects in endurance sports. 3. Longevity and vascular health. Here's where it gets really exciting. Researchers are investigating whether long-term use of PDE5 inhibitors like Tadalafil could reduce the risk of cardiovascular and metabolic diseases by improving endothelial health, the inner lining of blood vessels, including those in the lungs. A healthier endothelium may mean lower inflammation, better oxygen exchange, and potentially longer life expectancy. So, while most people think of Tadalafil as just a sexual health drug, the hidden benefit could be protecting vital organs like the heart and lungs. And that's something no one expects when they first hear about it. Of course, this doesn't mean Tadalafil is a miracle pill or that everyone should take it, but it does show how a drug designed for one purpose can sometimes unlock new medical frontiers. And now, after exploring all the benefits and risks, it's time to wrap everything together with a clear, practical conclusion. In the next and final chapter, we'll summarize the journey of 30 days on Tadalafil, highlight the key takeaways, and give you actionable advice to make the safest and smartest health choices. After 30 days of daily Tadalafil, the picture is clear. This medication is far more than just a performance enhancer. It's a powerful circulatory agent that can influence not only sexual health, but also cardiovascular function, mood, energy, and even lung performance. But the journey also revealed something important. Every benefit comes with a trade-off: headaches, muscle pain, indigestion, and the potential for dangerous interactions remind us that Tadalafil is not a casual supplement. It's a prescription drug that must be respected. Key takeaways. Week 1. The body adapts, circulation improves, but side effects may appear. Week 2. Confidence, libido, and subtle daily improvements in energy and mood begin to show. Week 3. Unexpected benefits emerge, including cardiovascular and exercise support. Day 30. Long-term adaptations stabilize, offering consistency in blood flow and overall performance. Hidden benefit. Potential protection for the lungs and vascular system, pointing to uses far beyond sexual health. Practical advice. Always consult a doctor before starting Tadalafil. Erectile dysfunction can be an early warning sign of serious disease. Never self-medicate or combine Tadalafil with alcohol, nitrates, or recreational drugs. The risks are too high. Focus on lifestyle. Exercise, nutrition, stress control, and sleep will amplify the positive effects far more than the pill alone. Use it as a tool, not a crutch. Tadalafil may help you, but true health comes from long-term habits. So here's the question. Is Tadalafil a miracle? No, but it can be a game changer when used responsibly and under medical supervision. And if you found this journey eye-opening, don't stop here, because the truth is, there are other everyday drugs and supplements with shocking, little-known effects on your health. Check out our next video, where we reveal how a common over-the-counter pill, taken by millions, might be silently protecting your heart without you even realizing it.